I'm Jackie Doidge with ODNS, and today we're discussing the results of the work by Helene Longevan. And her work is very important to us because it gives us some background as to supporting the effects of superficial dry needling. And any good course is going to teach you both techniques. We don't always do dry needling, and very often I use my superficial dry needling in cases where the patient is very sensitive to the needles and has a large pattern of trigger points which you want to affect, very often along a line of pain which is like a radiculopathy. And they will have a pattern of trigger points which often start in the low back, go through the hip, for instance, and along the lateral thigh in the instance that I'm kind of using as a demonstration today. As we do the dry needling, we put the needle only superficially for this technique, and we use a small needle. And when you come to take the course, you'll learn how to do this. It can be very effective in many, many situations, and the work by Peter Baldry, of course, gave us a lot of our theory behind how superficial dry needling works. So today I'm going to do a dry needling of the lateral thigh. I may have already passed through several points doing the dry needling. The work with Helene has showed us that when we twirl the needle, we get a wind-up of that connective tissue. And perhaps these fibromyalgic patients actually have more the syndrome of their fascia rather than just their muscle. So when we use this technique, we find the tender point, quickly bring that in. You do want to get below the dermis to the fascia, which is about there. You could feel it already. We saw that our patient jumped with that. And now that he's feeling that sharpness of the needle, you give it a wind up, about 2 revolutions, and you should feel, there it is, the tug that you get with that wind up. In this situation, you might leave it for a minute or two, waiting for that stretch to occur in the connective tissue. And having left it there for a few minutes, you feel it again. Once that tug is gone, it's ready to go, and out it comes. So when you come to do your courses with us, you'll learn that superficial technique. Again, very effective with the super sensitive patients.